Bonjour et merci de vous être rejoint à nous aujourd'hui. Canadians must continue to practice physical distancing. Please stay strong and stay at home. I know how hard it is. It's so important. Unless, of course, you are doing essential work like stocking grocery shelves, or you're on the front lines of our healthcare system. And if you are doing that essential work, thank you very much. I know that many Canadians today are struggling to make ends meet. That's why I'm glad to be able to say that applications for the Canada Emergency Response Benefit are now open. To make sure the system works, we are staggering the days Canadians can apply based on their birth month. We Canadians are resilient. We are survivors. I know we will get through this together. Les Canadiens et Canadiennes doivent continuer à pratiquer la distanciation physique. Restez forts et restez à la maison, à moins que vous fassiez un travail essentiel, comme remplir les tablettes à l'épicerie ou fournir des soins de santé. Je sais que les Canadiens et Canadiennes souffrent. C'est pourquoi je suis heureuse de dire que les Canadiens et Canadiennes peuvent maintenant postuler à l'aide de la prestation canadienne d'urgence. Pour nous assurer que le système fonctionne bien, nous échelonnons selon les mois de naissance les jours durant lesquels les Canadiens et Canadiennes peuvent postuler. Les Canadiens et Canadiennes sont résilients. Nous allons passer à travers ensemble. Okay, and today we are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, and the Deputy Chief Public Health Officer, Dr. Howard Njoo, et le Président du Conseil du Trésor, Jean-Yves Duclos, and of course, Canada's Minister of Health, Patty Hajdu, is here and also available to answer your questions. Thank you. Dr. Tam, please.
Hello, everyone. As usual, I'll start with the update on the numbers of COVID-19 cases in Canada. There are now 15,822 cases with 293 deaths. Most concerning are new outbreaks in hospitals and long-term care facilities, which are occurring in several provinces. As well, we are hearing of young people being hospitalized due to COVID-19 and people as young as in their 20s dying of the disease. This is a serious health threat to everyone, and although older ages are most at risk, no one can predict when critical illness will strike someone at any age. On the lab front, over 339,000 people in Canada have been tested to date, with about 5% confirmed as positive, and we'll continue to test at a high rate to track where spread is occurring. In good news, British Columbia recorded a lower number of cases this week compared to last. While it is still too early to tell, this continues to encourage us that our collective action can slow the spread of this pandemic. And though there is cause of cautious optimism, we must not relax any of our efforts, from practicing physical distancing, frequent hand washing, and covering coughs to protect our most vulnerable. As I noted yesterday, our collective scientific knowledge of COVID-19 continues to grow. Now that more countries have had larger number of cases and have analyzed transmission patterns, it is clear that transmission of the virus is happening more often than previously recognized from infected people right before they develop symptoms. This is called pre-symptomatic transmission. There is also evidence that some infected people who never develop symptoms are also able to transmit the virus. This is called asymptomatic transmission. We still do not know how big a role pre-symptomatic and asymptomatic transmission play in driving this pandemic, but we know that it is occurring. With this emerging information, the Special Advisory Committee on COVID-19 has come to a consensus that wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you. In situations where physical distancing is difficult to maintain, such as in public transit or maybe at a grocery store, A non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or land on surfaces. So wearing a non-medical mask in the community has not been proven to protect the person wearing it. It is an additional way that you can protect others. Wearing a non-medical mask in the community does not mean you can back off the public health measures that we know work to protect you. So you must continue to practice physical distancing and good hygiene, like frequent hand washing and regularly disinfect high-touch surfaces. And I want to emphasize that it's extremely important that we keep the supply of medical masks where it is needed. Healthcare workers need medical masks. We are still in a very critical stage of Canada's COVID-19 epidemic, and this is no time to relax our preventive measures. As Canadians, we may not outwardly demonstrate our pride, but our hearts are full of it, and we are determined people. When someone says flatten the curve, we say we'll plank it. We are stronger together, and we will get through this together. Donc, ça va bien aller. Thank you.
Thank you, Dr. Tam. Dr. Njoo, please.
OK. Bonjour. Comme d'habitude, on va commencer en faisant le point sur le nombre de cas de COVID-19 au Canada. On compte en ce moment 15 822 cas au pays, dont 293 décès. Ce qui nous inquiète le plus, ce sont les éclosions dans les hôpitaux et les établissements de soins de longue durée, un problème auquel plusieurs provinces sont confrontées. Nous savons aussi que des jeunes sont hospitalisés à cause de la COVID-19 et que des personnes d'à peine 20 ans meurent de la maladie. Il s'agit d'une menace sérieuse pour la santé de tous. Et bien que les personnes âgées soient les plus à risque, personne ne peut prédire à quel moment une personne tombera gravement malade, quel que soit son âge. Du côté des laboratoires, plus de 339 000 personnes ont subi un test de dépistage au Canada. Environ 5 ont reçu un résultat positif et nous continuons d'effectuer de nombreux tests pour déterminer où se propage la maladie. Il y a aussi de bonnes nouvelles. Cette semaine, la Colombie-Britannique a enregistré moins de cas que la semaine dernière. Bien qu'il soit encore trop tôt pour nous prononcer, cette baisse continue de nous pousser à croire que notre action collective peut ralentir la propagation de la pandémie. Même si nous pouvons nous promettre un certain optimisme, nous ne pouvons pas relâcher nos efforts, qu'il s'agisse de pratiquer l'éloignement physique, de nous laver souvent les mains, de nous couvrir la bouche pour tousser ou de protéger les personnes les plus vulnérables. Comme on a mentionné hier, notre connaissance scientifique collective de la COVID-19 ne cesse d'augmenter. Maintenant que nombre grandissant de pays ont enregistré de nombreux cas et analysé les modes de transmission, on se rend compte que les personnes infectées transmettent le virus plus souvent qu'on ne le pensait, c'est-à-dire juste avant de présenter des symptômes. C'est ce qu'on appelle la transmission présymptomatique. Il est également prouvé que certaines personnes infectées peuvent transmettre le virus sans jamais présenter de symptômes. C'est ce qu'on appelle la transmission asymptomatique. Nous ne savons toujours pas quel rôle joue la transmission présymptomatique et la transmission asymptomatique dans la progression de la pandémie, mais nous savons qu'il existe. Sur la base de ces nouvelles informations, le Comité consultatif spécial sur la COVID-19 a convenu d'un commun accord que le port d'un masque non médical, même si vous ne présentez aucun symptôme, est une mesure supplémentaire que vous pouvez prendre pour protéger les personnes de votre entourage. Dans les situations où la distance physique est difficile à maintenir, par exemple dans les transports en commun ou à l'épicerie, un masque non médical peut réduire le risque que vos gouttelettes respiratoires entrent en contact avec d'autres personnes ou atterrissent sur les surfaces. Il n'a pas été prouvé que le port d'un masque non médical dans la communauté protège la personne qui le porte. C'est une façon de plus de protéger les autres. Le port d'un masque non médical dans la communauté ne signifie pas que vous pouvez renoncer aux mesures de santé publique qui, nous le savons, permettent de vous protéger. Vous devez continuer à pratiquer l'éloignement physique et avoir une bonne hygiène comme vous lavez souvent les mains et désinfectez régulièrement les surfaces qui sont fréquemment touchées. Par ailleurs, on tient à souligner qu'il est extrêmement important que nous gardions les masques médicaux pour les personnes qui en ont le plus besoin. Les travailleurs de la santé ont besoin des masques médicaux. Nous sommes toujours à une étape très critique de l'épidémie de COVID-19 au Canada et ce n'est pas le moment de relâcher nos mesures préventives. En tant que les Canadiens, en général, nous extériorisons peut-être pas notre fierté, mais notre cœur est rempli et nous sommes un peuple déterminé. Quand quelqu'un dit « aplatissez la courbe », nous répondons que nous allons l'aplatir. Nous sommes plus forts ensemble et nous nous en sortirons ensemble. Ça va bien aller. Merci.
Merci beaucoup, Dr. Njoo. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves.
Merci, Chrystia. Bonjour tout le monde. Good morning, good afternoon, everyone. Le premier ministre Trudeau a fait 3 annonces importantes ce matin, de bonnes nouvelles du point de vue économique et du point de vue de l'appui du gouvernement canadien à toutes ces familles, à tous ces gens qui en ont absolument besoin de cet appui dans les conditions difficiles que nous vivons. La première bonne nouvelle, c'est le lancement ce matin du site pour déposer des demandes pour la nouvelle prestation canadienne d'urgence. 300 000 personnes ont déjà déposé avec succès une demande sur le site ce matin. Le site fonctionne bien, le site est solide. Nous continuons à travailler très fort pour qu'il le continue. Et une raison pour laquelle ce site fonctionne bien, c'est que les Canadiens sont disciplinés et déposent leurs demandes en fonction de leur mois de naissance. Aujourd'hui, les mois de naissance, c'est janvier, février et mars. Une deuxième bonne nouvelle en termes d'appui du gouvernement canadien aux Canadiens et aux Canadiennes, c'est que les 2,5 millions de demandes d'assurance-emploi qui ont été faites au cours des dernières semaines sont traitées rapidement. 2,5 millions de demandes en quelques semaines, c'est plus que ce que le gouvernement canadien reçoit généralement durant une année complète. De ce 2,5 millions de demandes, il y en a 2,1 millions qui ont été traitées au cours des 2 dernières semaines. Alors, dans 2 semaines, il y a à peu près le même nombre de demandes d'assurance-emploi qui ont été traitées que celles qu'on traite généralement en 1 an. On rappelle que ces personnes qui ont déjà déposé une demande d'assurance-emploi n'ont pas besoin de demander une prestation canadienne d'urgence puisque leur demande d'assurance-emploi est automatiquement acheminée vers une demande de prestation canadienne d'urgence. Et la dernière bonne nouvelle, c'est que nous avons tous un rôle à jouer en matière sanitaire, mais aussi en matière économique. Le système bancaire, incluant le mouvement coopératif et Desjardins, ont aussi un rôle très important à jouer. Donc, on est heureux d'apprendre qu'ils ont réduit de manière importante les taux d'intérêt qu'ils demandent sur les cartes de crédit et on s'attend et on espère que le secteur bancaire va continuer de faire en sorte que tous et toutes fassent leur part. On va tous sortir de cette crise ensemble et on est heureux donc de la collaboration de l'ensemble des acteurs économiques. Merci, Chrystia.
OK. Merci, Jean-Yves. On est prêt à répondre aux questions.
Merci. Alors, comme d'habitude, 3 questions au téléphone, 3 questions dans la salle. 1 question, 1 follow-up. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Micheline Tam de Radio-Canada. La parole est à vous.
Oui, bonjour. J'aimerais savoir, en fait, on a reconnu que la PCU ne rejoint pas tous les besoins de milliers de Canadiens qui ont perdu leur revenu. Alors, quels sont les travailleurs qui vont être touchés particulièrement parce que vous allez annoncer? Est-ce que ça va être rétroactif? Et aussi, allez-vous faire des ajustements à la subvention salariale aux entreprises qui, selon plusieurs dirigeants, ont trop d'obstacles et donc ils ne peuvent pas y accéder?
Merci pour la question. Et comme on sait, nous sommes dans une situation d'urgence qui demande des mesures d'urgence. Et c'est pour ça que depuis déjà quelques semaines, on fait ce qui est normalement exigible en des mois ou des années de travail de la part du gouvernement fédéral, c'est-à-dire répondre à des besoins essentiels, les besoins substantiels, les besoins urgents d'appui à nos travailleurs et à nos entreprises. La prestation canadienne d'urgence, le premier ministre l'a abordé un peu plus tôt ce matin dans son point de presse. On sait qu'elle couvre beaucoup des travailleurs qui en ont besoin, et ça inclut des travailleurs qui n'auraient normalement pas droit à une prestation en situation de chômage ou de perte de revenus de la part du gouvernement fédéral, c'est-à-dire tous les travailleurs qui n'ont pas droit normalement à l'assurance emploi, les travailleurs autonomes, ceux qui n'ont pas accumulé suffisamment d'heures, ceux qui se retrouvent en situation de zéro revenu pour des raisons qui n'ont pas de lien avec leur situation, de lien d'emploi avec leur employeur. Mais ceci étant dit, il y a encore des trous dans la couverture de la prestation canadienne d'urgence, et c'est pour ça que le premier ministre Trudeau a identifié ce matin 3 catégories de gens pour lesquels du travail additionnel est en train de se faire, avec évidemment la collaboration de la ministre Qualtrough et du ministre des Finances, M. Morneau. Si je résume, les 3 sur lesquels on travaille particulièrement fort ces temps-ci, ce sont ceux qui ont perdu beaucoup d'heures de travail, mais pas nécessairement toutes leurs heures de travail et donc tous leurs revenus. On parle de gens qui n'auraient pas présentement un revenu aussi élevé que le 2000 $ de prestations canadiennes d'urgence. Et on parle finalement aussi d'étudiants qui, dans certains cas, vont avoir la difficulté à trouver un emploi au cours des prochaines semaines et des prochains mois. Par contre, rapidement, sur la question des étudiants, laissez-moi vous rappeler ce qui existe déjà pour les aider. Un, c'est un report d'au moins 6 mois des versements de capital sur leur dette de prêt, sur leurs prêts étudiants qu'ils auraient pu contracter au cours des derniers mois et des dernières années. Donc, ils n'ont pas besoin de payer leur capital au cours des 6 prochains mois. Et en plus, l'intérêt qui aurait été accumulé au cours des 6 prochains mois, cet intérêt-là est totalement annulé. La deuxième chose, c'est que la prestation canadienne d'urgence, elle profite déjà à plusieurs étudiants qui ont accumulé au cours de la dernière année 5 000 $ de revenus et qui ont pu perdre leur emploi dans le secteur de la restauration, dans le secteur des services, comme employés à l'université ou dans un cégep. Donc, ces étudiants ont déjà droit maintenant à la prestation canadienne d'urgence. Et la troisième chose qu'on a déjà mise en place, qui est très importante pour les étudiants, c'est cette subvention salariale de 75 % qui amène les employeurs à engager et à réengager des travailleurs, dont des étudiants qui auraient autrement été sans emploi et sans revenu. Finalement, sur la question de la subvention salariale elle-même, mais comme on sait, comme c'est très important, le ministre Morneau travaille très fort pour en préciser tous les détails.
Okay.
Oui.
Et si je peux seulement ajouter une phrase en français que peut-être Jean-Yves peut répéter en anglais. Concernant les gens qui travaillent 10 heures par semaine ou moins, ça inclut évidemment les pompiers volontiers, qui sont une catégorie très importante pour beaucoup de municipalités canadiennes. Et nous avons discuté la situation. Beaucoup de députés ont soulevé cette question et on va régler cet enjeu important.
So thank you. I'll say that briefly in English. So what is currently happening is that the federal government is reacting in an emergency situation and in an emergency manner, which we haven't seen in the history of the social safety net of Canada. So that means that we are putting into place things like the Canada Emergency Response Benefit, things that would normally take months, if not years, to implement. We're doing this because we know that what already exists is helping millions of Canadians, and we're seeing this morning the impact of that with more than 300,000 applicants already having successfully deposited their request for a CERB. Now, we know, as Prime Minister Trudeau said just a moment ago, that there is more to do. And there are 3 categories of people that Prime Minister Trudeau focused on just a moment ago. First, those that have reduced hours of work but have not lost all of their income or all of their hours of work. So we're mindful of that. Also, those that would be receiving less in income than the $2,000 per month of the Canada Emergency Response Benefit, and those like students that would have a hard time finding a job at a moment in the year at which they would normally be trying to find a job to pay for their expenses. Now, the good news about the students is that although there will be more to come, there have already been many important things for them. First is the delay for at least 6 months of their payment for their student loans. So the capital payments can be brought forward by at least 6 months, and all of the interest that would normally accrue on their loans will not be payable at all. So there will be no interest paid not only in the next 6 months, but that interest that would normally be paid in the next 6 months will not be asked for afterwards. The second thing is that the Canada Emergency Response Benefit is already helping thousands of students right now, because there are thousands and probably hundreds of thousands of students that have earned more than $5,000 in the last year, but that have lost their job, sometimes their part-time job in a restaurant or in a shop or at university as an assistant to their teacher. So there would be students that have lost their jobs, that had earned enough income last year, and that are eligible to asking for the Canada Emergency Response Benefit right now this week, starting today and the rest of the week. And finally, the wage subsidies. Those wage subsidies are very substantial. They will encourage and support businesses towards either rehiring or hiring students that would otherwise have lost their jobs. So this we expect will also be very important for the students in the next weeks, in addition to things that the Prime Minister said we would announce shortly.
Thank you. Minister Micheline, on suivi.
Oui, merci. Et puis, en ce qui concerne l'arrivage de masques qui provenaient des États-Unis, qui étaient destinés à l'Ontario, là, le premier ministre Ford a dit que ça a été prohibé. Alors, qu'en est-il et quel est l'état de la réserve nationale en ce moment?
J'ai discuté cette situation avec le Premier ministre Ford il y a 15 minutes avant notre conférence de presse. On est très engagé avec toutes les provinces et on fait du travail acharné avec les États-Unis pour nous assurer que tous les masques qu'on a achetés peuvent être exportés au Canada. Et on a eu des conversations positives et on continue de travailler à régler cette situation très importante pour notre pays. Concernant la situation avec les soins médicaux en général, toutes les provinces font du travail acharné, le fédéral aussi. C'est vrai que la situation en Ontario est une situation qu'on connaît très très bien. On a une très très bonne communication avec la province, avec le Premier ministre, et on va continuer de travailler très très fort pour assurer que les gens qui font le travail essentiel pour nous protéger dans nos hôpitaux ont les équipements duquel ils ont besoin. Sure. So we are very aware of the situation that Ontario experienced with some masks it had purchased in the United States and having some trouble getting them across the border. I spoke about that with Premier Ford just a few minutes before this press conference and immediately called Ambassador Hillman, who is now very seized of the issue also. More broadly, we have been working throughout the weekend very, very hard with our American neighbors to ensure that medical supplies can continue to flow across the Canada-U.S. border. And let me emphasize, as we emphasized in our conversations with our American neighbors, that flow is a two-way street. The relationship when it comes to medical supplies, when it comes to healthcare between Canada and the United States is, like all aspects of our economic relationship, very balanced, very reciprocal. And that is why a win-win outcome where both parties continue to help each other is the very best outcome. That is the point we have been making, and we had some positive conversations over the weekend, and we're going to continue to have those conversations.
Thank you, Deputy Prime Minister. Next question.
Thank you, merci. The next question is from Alex Valengal from the Toronto Star. Please go ahead.
Hi, thanks for taking my question. Just to expand on that, Premier Ford put out a statement this morning saying that Canada is working to try and get an exemption from the U.S. order on preventing the export of PPE. I'm wondering if you can confirm that and expand on what exactly these productive talks are about that you're having with the Americans.
Yeah, exactly that. We believe that the flow of medical equipment through the supply chain between Canada and the United States needs to continue unimpeded. And that, of course, is a two-way street. Both countries benefit from this, and both countries would lose out if hurdles were to be put in the way of that flow of healthcare support between our two countries. We made that point in repeated conversations over the weekend and today. As the Prime Minister said, we feel we are being heard, and we look forward to a definitive resolution of this situation. It's in the interests of both countries to continue supporting each other when it comes to healthcare. Let me just add, I also spoke to the global CEO of 3M, Mike Roman, who has been doing a great job. The company is taking a very, very responsible position. They understand the very special place they are in right now. And I would really like to commend the company for its approach and for its very constructive relationship with Canada.
Alex, follow up?
Just the Prime Minister mentioned shipments from other countries have been delayed and there's been stuff missing from shipments that have arrived. Do you have any more details on which countries had shipped things that were delayed and exactly how much stuff has been missing from the shipments that have arrived in recent days?
Look, as Minister Hajdu, as Patty pointed out at one of these press conferences last week, it is really a wild west when it comes to buying medical supplies right now. This is a global pandemic, and every country in the world is doing its best in a truly fierce competition to get medical equipment. Canada, working very closely with all of our provinces, is working really, really hard in the international marketplace to get all the supplies we need. It's hard, but that's why we have to work even harder. And it is also why I am so grateful to all of the Canadian manufacturers right across the country who are stepping up to figure out ways that we can make the medical equipment, the testing equipment that we need here in Canada. So it's a two-pronged approach. We are working hard, but it is absolutely very, very tough right now.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you, merci. La prochaine question de Marie Vestel, Le Devoir. La parole est à vous.
Oui, bonjour, Madame Freeland. J'aimerais continuer là-dessus en français. Pouvez-vous confirmer que votre gouvernement cherche à obtenir une exemption des États-Unis sur cet ordre de cesser les exportations d'équipements médicaux? Et vous avez dit aussi en anglais que you're looking forward to a definitive resolution. Pouvez-vous nous dire quand est-ce que vous attendez une réponse à cet effet des États-Unis ou combien de temps vous êtes prêt à attendre?
Oui, je peux confirmer que la position du Canada est que on doit continuer avec les États-Unis d'avoir le commerce dans les soins médicaux qu'on a jusqu'à ce moment. Je veux souligner pour les Canadiens ce que le gouvernement du Canada a souligné dans nos conversations avec nos homologues américains. Et c'est que c'est une relation réciproque. Le Canada exporte beaucoup d'équipements médicaux et aussi nos professionnels font du travail extraordinaire aux États-Unis. C'est bon pour les Américains. En même temps, le Canada, les États-Unis exportent des équipements médicaux qui sont nécessaires pour nous. Continuer d'avoir cette relation réciproque est dans les intérêts de tous les deux pays. Nous avons maintenant une relation gagnant-gagnant et c'est ce que nous voulons préserver. On a eu beaucoup de conversations pendant le fin de semaine et aujourd'hui concernant cet enjeu. Les conversations étaient positives et nous espérons que ce sera possible très vite de régler définitivement cette situation.
Ouais, OK. Et pour ce qui est de l'entreprise 3M, vous dites que vous êtes entretenu avec eux cette fin de semaine. Avez-vous obtenu des assurances dans leur déclaration vendredi dernier? L'entreprise semblait réticente à cesser d'exporter ses masques vers le Canada. Avez-vous obtenu des assurances que 3M va ignorer l'ordre de Washington et qu'on va recevoir les commandes qu'on avait placées chez eux?
Je ne suis pas d'accord avec la proposition dans la question. Ce n'est pas pour une compagnie, une entreprise d'ignorer les lois de sa propre pays. C'est pour les pays de régler ces relations entre eux. Concernant 3M, on a une conversation constructive. L'approche de 3M, j'apprécie beaucoup, c'est très responsable et on a discuté ce que 3M a besoin du côté d'État américain pour continuer d'exporter ses masques au Canada. On a aussi discuté avec 3M un élément central et c'est la dépendance mutuelle, la dépendance réciproque de nos deux pays.
Merci, Madame la Vice-Première ministre. We'll now turn to the room, starting with Julie, CBC.
Yeah, Ms. Freeland, you were saying that you spoke to Doug Ford 15 minutes before he came here. He talked about some masks and some trouble at the border. So how many masks, where were they coming from, what was the trouble, and exactly how are you going to resolve this?
I'm going to let Premier Ford talk about the specifics of this particular province of Ontario purchase as he chooses. We did speak about the fact that some masks that the province had purchased in the United States were having some difficulties in being shipped across the border. And I pledged to the Premier that the federal government would do everything we can to get those masks into Canada, and we will.
All right. I have other questions for you, but unfortunately I have to move to masks. Now, Theresa Tam, about the cloth masks that you say is probably beneficial for Canadians to wear right now. Why would it have taken so long, considering we know how infectious this virus is, and we know that people can carry it and not know it? So a mask, how could that have hurt? Why didn't you say weeks ago, wear a cloth mask?
So the evidence is actually still quite weak. What the evidence that just came to light in, I would say, the last 10 days actually came from a few studies about asymptomatic and pre-symptomatic illnesses. So I think, as I was trying to explain yesterday, there's several different types of studies. and they will publish a number of them in the last little while. So they are very specific studies in a long-term care facility, the Diamond Princess cruise ship, and a hospital setting, for example, and a study from Singapore. And then that last one was released on April 1. So you have to take the evolution of the evidence as rapidly as possible. And so the viral load studies show that, yes, people who are just before they develop symptoms have high viral loads. And so that tells us that the possibility is there that they can transmit. We still don't know exactly how important transmission from the pre-symptomatic or asymptomatic people are in driving this epidemic. There are other epidemiologic studies as well, for example, in the Seattle long-term care facility. So these are very recent studies that's just come out on this particular virus. And so we very rapidly try to integrate that latest science. On the issue or the area of wearing masks to protect others, which is what we're talking about is non-medical masks, which may be made of cloth, for example, for people making it at home as an added layer of protection, is a bit like covering your cough. I think the Special Advisory Committee looked at the literature around the use of masks for this sort of source control, and it's actually mainly from influenza studies, and they are not very clear. So we want everybody to be aware that the science is not certain, but we believe in we need to do everything that we can. It seems a sensible thing to do. So I think we recommend that Canadians can take this additional measure at instances where social distancing is difficult to maintain. So our strongest message really is that you must continue to do social distancing, that 2-meter bubble, and hand washing, stay home you're sick. All of those things are the effective measures. This may add a layer of protection to prevent you from transmitting someone to others before you actually know that you have the illness. So I think that needs to be very clear. And the other key message, of course, is that medical masks right now, as you've just heard about the challenges with supplies, that they must be preserved for our health workers and others who are looking after patients.
Thank you, Doctor. Next question.
And with CTV National News. Over the last couple of days, you have said that people shouldn't wear medical masks. So you're asking people to essentially wear non-medical masks now as a way to prevent themselves and others from spread. I'm just wondering if you could be clear for Canadians on the guidelines when you say non-medical mask. What are you talking about? Because now, hardware stores are closed. Lots of Canadians at home might be looking to make a homemade mask. So what are you suggesting they wear? What are those guidelines?
Yes, so we'll be, we have some suggestions on our website, but we'll be putting out more additional tools for people to think about. So we're talking about things that are readily available in anyone's home, things like cotton shirts, sheets, bandanas, and other materials. But we're also going to tell people things that they shouldn't use as well. And we have our engineers looking at the evidence on those. But I think it's simple things that not complicated, and preferably no sewing required, because I, for one, can't sew anything. So if you can get a cotton material, like a T-shirt, you cut it up, you fold it, and then put elastic bands around it, other sort of non-medical facial coverings that we're talking about. And we will see what kind of tools we can provide in short order.
I just wanted to ask you a follow-up question on test kits. Over the last number of days, we've been asking you a lot of questions about shortages of personal protective equipment like masks, ventilators. How many test kits do we have in Canada at this moment? And can you give us a sense of how many test kits we might need should we see a dramatic number of cases increase and a number of people getting sick? Like, how many test kits do we have and how many do we need moving forward?
I think, as I've said Canada is testing at quite a high rate compared to many other countries. And we're pulling out all stops again to improve the capacity in Canada. It's not a matter as simple as just a kit. Obviously, there are, throughout that pipeline of testing, there are swabs, there are other pieces, but there are also reagents that people need to use to extract materials from the swab and then test it. So there are many different components. And right now, Canada is doing well, but we are trying to make sure we get the right reagents. Like all supplies, the global supply chains are very difficult. So we are looking at how can we look at made in Canada solutions. And also we're at the moment looking at validating things like more rapid test kits, little equipment that can be then sent to, for example, the north or more remote areas that can't send their samples to a public health lab. And some of the initiatives are actually changing the testing capacity at the bigger labs into more high throughput machines and procedures. So it's not a matter of just counting kits. So again, efforts are all out on that, as well as, so that's mainly tests for the detection of the virus through PCR. And we're also, of course, working on looking at the antibody tests.
Thank you, Dr. Mike, Global.
I guess I'm going to follow up with that. So why aren't we doing more testing? Is it because of the lack of resources or lab supplies or personnel? Is that why we're not testing a lot of these people who are asymptomatic or not pre-symptomatic?
Yeah, so we have, through our federal, provincial, territorial discussions, guidance provided. So for sure, we want the supplies to be utilized in the most effective way possible. So that does mean testing in situations where you're most likely to be finding infection and in the most high-risk situations. So like in outbreaks, in cluster detection, in healthcare workers, in highly vulnerable communities, including Indigenous communities, they're absolute must, and we have to do well in long-term care facilities, for example. For others, we've already provided instruction that if you're sick, you must stay at home. And others are practicing social distancing to the effect that even if you're pre-symptomatic, you shouldn't be, within the distance to spread it to other people, and with maybe added protection like these homemade masks. So the test doesn't actually drive potentially the public health action. So you want the test that you have and whatever you have on populations where you are going to make a decision after you've actually got the test result. So if you're just staying home anyways, we're going to be prioritizing others. We are looking, of course, and people are very interested in serologic testing, which will help us look at the level of immunity in certain populations and a little bit further on in our studies. And so that's a different approach, but it is one that we're pursuing as well. But the rate at which we test is quite high, but it is a bit different depending on where you're in Canada. So we want the resources to go to areas that are, for example, experiencing the highest activities as well.
Okay. And so we're just learning about this asymptomatic, pre-symptomatic things, but how are we going to get back to normal without higher levels of testing? Like if people are walking around with this virus that don't even know it?
Yes, so obviously when you're walking around, practice social distancing, of course. And so it's an extremely good question. And you're going to hear many sort of opinions, if you like, as to how many proportion of your population is asymptomatic and got the infection, which is precisely why we need to do studies, as time goes on. Because right now our focus is to tackle this actual outbreak. At some point in the near future, we will be looking at how do we apply serologic testing, for example, to look at the level of immunity in the population. And those kind of studies will let us know to what extent the virus has been affecting people in a very mild way, or very little symptoms, if at all. So those do have to be done, and it has to be also done in a global setting as well.
Thank you, Doctor. We'll now turn back to the phone. Operator.
Thank you, merci. La prochaine question est de Raymond Filion de TVA. La parole est à vous.
Oui, bonjour. Une question pour Dr. Njoo au sujet du port des masques non médicaux. Je ne vous ai pas entendu prononcer le mot recommandation. Est-ce que c'est quelque chose que vous recommandez aux Canadiens ou pas?
OK. Merci pour la question. Pour commencer, je vais souligner quelques points très importants. Premièrement, si on parle des masques non médicaux, c'est aussi très important de dire qu'il faut consacrer, c'est absolument nécessaire, critique de consacrer les masques médicaux pour les personnes qui sont sur le terrain en première ligne. Ça veut dire les travailleurs de soins de santé. Ça, c'est point clair. Deuxièmement, un autre un point important, c'est que même si on parle de masques non médicaux, c'est très important de garder aussi les mesures parce que si on ne faut pas donner comme une fausse sens de sécurité aux gens. C'est, si je porte un masque, c'est pas nécessaire de pratiquer l'éloignement physique, de se laver les mains, tout ça. Non, c'est absolument critique de continuer avec les bonnes hygiènes et les pratiques de santé publique. Troisièmement, si on parle des masques non médicaux, c'est ça ligne avec ce qu'on a déjà dit que oui, si on est peut-être malade, si on tousse, il faut toujours tousser dans la manche. C'est une autre mesure supplémentaire au lieu de peut-être tousser dans la manche. Peut-être c'est dans un masque non médical. Et un autre point important, c'est que si on utilise un masque non médical, c'est plus peut-être pour protéger les autres. C'est pas pour nous protéger contre les autres. Parce que si on tousse, ça peut attraper peut-être les gouttelettes respiratoires et aussi peut-être pour contaminer des surfaces. Comme on a dit avant, le comité consultatif spécial sur la COVID-19, on a convenu un commun accord et tous les médecins hygiénistes en chef de toutes les provinces et territoires sont d'accord que c'est une autre mesure supplémentaire. C'est quelque chose, on peut en servir, mais c'est pas comme une recommandation. C'est comme dire un conseil permissif. Merci.
Très bien. Donc, c'est pas une recommandation, c'est compris. Question de suivi pour Monsieur Duclos. On reçoit beaucoup de courriels au sujet des pompiers volontaires. Vous en avez parlé vendredi. Qu'est-ce qu'il en est? Est-ce que c'est maintenant officiel que les pompiers volontaires pourront recevoir de la prestation canadienne d'urgence ou non?
La réponse est oui.
C'est fait. Merci.
Okay. Next question.
Thank you. The next question is from Chrystia from the Globe and Mail. Please go ahead.
Hello, good afternoon. Thanks again for doing this. My question pertains to the now confirmed cases, particularly in First Nations that have confirmed cases in recent days. And I know the Chief Public Health Officer has already said that even one case in Indigenous communities has the potential to be devastating. I'm just wondering, I know the government has already earmarked some funding, $305 million for Indigenous community support, but what is being done in the immediate term to support communities like one in Northern Ontario that doesn't have water and now has this confirmed case of COVID-19?
Thank you, Chrystia. I spoke with Chief Bellegarde this morning about that particular case up in northwestern Ontario, and also will be speaking with Chief Fiddler later today, sort of in my neck of the woods as a Northern Ontario Member of Parliament. And I will say that according to Chief Bellegarde, the person is self-isolating. You're right. It is way more difficult to self-isolate and to practice regular hand washing and done regular cleansing when you have a situation where there maybe aren't those kinds of facilities or people are crowded in overcrowding situations. I know my colleague, Minister Miller, has been working very carefully with all of the First Nations leaders around their own pandemic plans, of which First Nations communities have, and is working to make sure that they have the resources they need to provide the appropriate medical care and the appropriate follow-up, as well as additional supports if people cannot properly self-isolate. I can't speak to this specific case in terms of where they're at, but I do know that Chief Bellegarde feels very confident that our government is taking this seriously and that we're there to support First Nations in ensuring that they have the measures they need when cases are identified. And I'll turn to Dr. Tam to speak a little bit more about Indigenous communities.
Yes, we, of course, work with the medical and public health side on the response, so working with Indigenous Services Canada. And our role has been to, of course, provide guidance and how to manage outbreaks in those kind of settings. And so we've also issued guidance to for public health actions in more remote and rural settings as well. And those do have to be adapted to the realities of what's on the ground. And I think we're offering support also for communities where it is difficult to isolate in, for example, crowded conditions. So those are some of the measures that we are pursuing.
I'm just wondering, as a follow-up, you mentioned that in some communities that embracing the public health advice like physical distancing can be very difficult or more difficult than in other locations. I'm wondering, in a community where there might be an overcrowding problem and a person might have difficulty self-isolating, what options would be available, or is there a specific plan being looked at to potentially remove people from communities that just don't have the luxury of trying to figure out where to self-isolate?
Thanks again. I know that Dr. Wong, who is the public health officer with Indigenous Services Canada, has been working with First Nations communities on plans to deal with positive cases for some time. Certainly, there's always an option of providing additional supports for alternative living spaces for a whole variety of circumstances. Those have to be balanced carefully with the additional risk that it may pose to Indigenous communities. Of course, taking people out of their community prevents a whole host of other challenges that sometimes are equally risky for the particular individual. So I can't speak to this particular case. I did understand from my conversation with Chief Bellegarde that this person is isolating at home, but of course each circumstance will be different and each community will be different. Safe to say that these are the kinds of considerations that are being considered by First Nations community leaders as they work through their pandemic plans with Indigenous Services Canada.
Thank you, Minister. Operator, last question, please.
Thank you, merci. La prochaine question est de Ina Gibb, de la presse canadienne. La parole est à vous.
Oui, bonjour. My question is for Dr. Tam or Minister Hajdu. I got really confused. So if it's not a recommendation, these non-medical masks that you should be wearing, you said you should be wearing when you're getting close to people, even though it's not protecting you, it's protecting other people. If it's not a recommendation, what exactly is it that you're saying? And why did it take you 3 weeks to come up with this?
So as I said, some of the emerging evidence have only recently been published. So we are incorporating those as we are going along. And also in the international community, you've seen that different public health experts and different countries around the world is looking very intensely at this particular issue as we have done. And so really is as of yesterday, with all the chief medical officers of health of the provinces and territories, we are issuing essentially a statement which sort of essentially state that Canadians can wear these coverings or non-medical masks if they can't maintain physical distancing. So it is a permissive statement, and essentially depends on the circumstances, because we want to make sure people are practicing the public health measures that have already been recommended and not substitute this. And so this is an added layer that someone can take to further prevent spread to others.
And if I can just add to that, I think what Dr. Tam has said in the past was ultimately, at the end of the day, social distancing is the best protective factor. Staying 2 meters away from people, making sure that you're observing the practices of protecting those around you by making sure that you maintain that distance. But there may be times where you are not able to. For example, if you're taking public transit and you know that your bus is likely to be crowded that morning, if you have to go to the grocery store and you're uncertain about whether or not the store is following practices that allow you to continue social distancing. And so I think that's why it's difficult to say universally that this is a recommendation, but there are certain circumstances where an individual may feel that they are not able to practice the social distancing or physical distancing, if you will, of 2 meters, and would like to take additional measures to protect the people around them.
Okay, so as I understand it, you recommend it on top of social distancing when you cannot do social distancing. And my other question, but anyways, I don't see why you just go ahead and say we are recommending this on top of everything else. Anyways, my other question, Dr. Tam, is can you explain to me if you are keeping tabs on hospital stays? And are you looking at that at all? Do you have all the data from all the provinces? And is that helping for you to assess the situation?
Yes, you can find some of this information on our website as well. We don't have hospitalization status on every single case, and these come from the provinces and territories. And of course, a patient's clinical status can change over time. But we do know that based on the information that we have, if you just looked at the more real-time data that provinces have been communicating, we do know the percentages of cases right now in terms of deaths and hospitalizations. And it has been, again, it depends on where you are in the country, but it has been around sort of the 8 to 10% mark. But we do have a subset of data where you can find it on our website in terms of age breakdowns, for instance, which again tells you that the people most at risk of serious illness are really people over the age of 80, over the age of 70. But you will see that younger age groups are also impacted by hospitalizations and deaths.
Thank you, doctor. Ceci met fin à la conférence de presse pour aujourd'hui.